Your Excellency, ladies and gentlemen, it is now my pleasure to invite the Deputy President to make his remarks and thereafter invite you to close this conference.
Thank you very much, Chair, Council of Governors, Your Excellency, the President of the Republic of Kenya, Excellencies, Ambassadors, Your Excellencies, Governors, CSS present, ladies and gentlemen, good afternoon. And let me say I'm very delighted this afternoon to join in this timely conversation on progress made in tackling the COVID-19 global pandemic, not just in Kenya, but globally. This discussion brings to fore what we as a country has done, what devolved governments have done, and I want to take this very early opportunity to thank His Excellency the President for providing steadfast leadership in mobilizing both state and non-state actors at all levels of government in responding to this pandemic that has seen us as a country in a very coordinated response that has given us positive results that today we are now discussing the flattening of the curve. Your Excellency, admittedly, some very difficult decisions have had to be made with very far-reaching effects on many aspects of us as a nation. But it is also fair to say that citizens of our nation, in their majority, have responded to your call to take up the decisions that have been made and to comply with the regulations and protocols that have been established by government. Many people have had to change their lifestyles, and they have done so graciously, realizing that we are all in this together. I think it is also instructive to note that as we plowed through this pandemic, there are some three things, in my opinion, that have stood out. Number one is that counties, the fact that we are having today this conference on this national pandemic, the counties have actually proven that they are not only centers of decision-making, centers of new growth, but they have also become centers of solutions to our challenges. And I want to congratulate the county leadership, the governors, the county assemblies, the speakers, and all that have provided the necessary leadership for counties to bring their wealth of knowledge and experience in managing this pandemic. I think the other issue that has come out is, as the President said, we should move from tactical to strategic thinking and intervention. This pandemic has actually brought into focus the need for universal health coverage that is part of the government's pillar on the future of our nation. If there was ever a justification that in fact the universal health coverage pillar is an idea whose time has come, it is now. That this pandemic is teaching us that while we can manage this pandemic using the interventions that are of an emergency nature, long-term solutions, however, provide a much more solid and much more, a better framework for managing this pandemic. And maybe the third thing I would want to say is that the response by counties, TVET institutions, and private sector players to manufacture PPEs locally and other usables is a clear indication that our manufacturing program is a program that not only provides us the mechanism to solve our immediate problems, but it
Well, we seem to have a slight challenge there with the signal of His Excellency, the Deputy President, William Ruto. We will have him back on shortly. But obviously, he began by congratulating Kenyans for the manner in which they have handled the disruption brought about by the pandemic. He also moved on to talk about county leadership and just applauding the different innovative ways in which county governments have focused on dealing with the pandemic, dealing with the disruption to business, and empowering local entrepreneurs at the same time. And of course, really then highlighting why universal healthcare is not an option. It must be strengthened. And that is what he was speaking about at that moment, rather than just looking at dealing with a pandemic, but rather long-term what universal healthcare can do to make the lives of Kenyans better, to ensure that should another pandemic, God forbid, happen again, that Kenya would find itself at a different level in terms of how it dealt with it. I want to believe we have his signal back on, and let me hand back to His Excellency, the Deputy President, at this time. Okay, I believe we possibly still have a challenge with that. We should be having him back on shortly. But of course, just before the Deputy President came on, we know that the Chair of the Council of Governors was reading some resolutions that have come out of the deliberations, day of deliberations that this virtual conference has managed to convene really experts from different fields to come and talk about county government's resilience in the COVID-19 era while reflecting on the past and building sustainability for the future. And of course, we know that His Excellency the President is on standby to speak just after the Deputy President to close this conference, probably emphasize on the recommendations that were made. Of course, the Chair of the Council of Governors, in some of the resolutions, I won't go through all of them, talked about how can both levels of government institutionalize strong intergovernmental relations exhibited during the COVID-19 pandemic, and moving forward, how can the national government and county governments jointly develop a county post-COVID strategy that is socio-economic, re-engineering, and of course, a recovery strategy as well. And there are about 15 of them. How can both levels of government also improve community health care, something very important at a time like this, operationalizing a health fund and ensuring community ownership in a pandemic response. Very important talking points at a time like this. And of course, one of the questions that came in that was very important was how can we move these recommendations to action, but also put in change management strategies, bearing in mind one of the speakers on one of the panels spoke about how certain sectors are averse to change. It takes a long time to change the mentalities of some of the players in key sectors. How can we ensure that we have change management strategies in place so that when new recommendations are brought, they're easily accepted, it's easy to transform, so that the story of a 3-year transformation can become a 3-month transformation as well.